Hi everyone, Dr Nav here at the AMI Clinic in Bedford, Doctor of Chiropractic and follower of the Eat Well, Think Well, Be Active movement. Okay, so if you've been checking us out on our social media platforms such as Facebook, Instagram or our blog, you'll know that our topic of the week is a spinal disc bulge or a disc herniation. What is the difference? Now the difference is simple. There is no difference. It's just different terminology. Now to explain a disc herniation, let's go through the anatomy. So if we have a look at the spine, so there's 24 individual vertebrae, and if we have a look at a joint complex here, we can see the vertebrae and the disc that sits in between the vertebrae here. So if we have a look at the disc structure, there's two parts. You've got the outer part, which is called the annulus fibrosus, which is a hard jelly-like structure. And you got the inner part, which is known as the nucleus pulposus, which is a softer jelly-like structure. So due to modern day lifestyle, what happens is that we can put stresses and strains along this joint complex, which can cause stress on the disc tissue. So over time, what happens is that you can get micro tear development along the disc tissue, and the disc starts to become hard. And so as a result, the jelly in the middle starts to leak through the actual the tears that take place, and that's what forms a disc bulge, disc herniation. So if we have a look here, you can see the inner part starting to flow through the tears, starting to form that bulge and starting to cause some irritation to the surrounding areas. Now, there are different classifications to a disc injury. You can get a disc bulge, a disc prolapse, and a disc extrusion. So if you have a disc injury that's putting pressure on that spinal nerve, some people can be symptomatic or asymptomatic. Now, it all depends on where that disc pressure lies on that nerve tissue. So if we have a look at the spinal nerve, you've got different components. You've got the motor part, autonomic part, sensory part, which houses the pain fibers. Now, if the disc stimulates those pain fibers as a result of that disc pressure, you will feel pain. Now, please stay tuned for next week's video as we will go through natural ways to try and reduce pain as a result of a disc injury. But for more videos like this, please give us a thumbs up, shoot a comment in the comment box below, and subscribe to our YouTube channel. But for more information on this week's topic of the week, a spinal disc bulge or a disc herniation, what's the difference? You now know. Please refer back to our social media platforms, but we'll see you next week. Thank you.